vision, spirit, creativity. Forces that drive discovery and innovation. Forces at work in American industry. Improving life today. Inspiring progress tomorrow.
The Shapiro Medical Group was founded by Dr. Ron Shapiro in 1994. Dr. Shapiro is a leader in permanent hair restoration, utilizing total follicular unit transplantation. He and his expert medical staff provide technical excellence in a supportive environment that ensures customer satisfaction.
We get patients that come to us with hair loss, and it's a very traumatic experience to these people. It really affects them socially, and so it's important. They're putting their looks in our hands. We can now use hair transplantation not just for cosmetic purposes, but also to help people who have had burns, scarring, post-cancer treatments where they've lost some of their hair. It's very rewarding, this part of the field. We don't want to have anybody disappointed, not one person. One's too much. So we really go out of our way to do everything we can to make sure that they're satisfied, that they're happy. You don't want to have an unhappy patient in the field of cosmetic surgery. You just don't.
With cosmetic surgery, it's very important that the patient knows what all their options are so they can make an educated decision, and in turn, hopefully that'll lead to realistic expectations of what their result's going to be. With hair restoration, as far as follicular unit grafting, which is the newest technique available, it allows you to isolate the individual hair groupings, and when the doctor places them on the scalp, it leads to the most natural result. So I think the patient should know what options are available and what different techniques are available so they can make a good decision on what type of procedure they want to have.
Wade Inskeep started noticing his thinning hair when he was in his late 20s. He suffers from relatively common male pattern hair loss, with a thin spot on the crown of his head and a receding hairline in the front. Wade has decided he's not happy with the genetic hand he's been dealt.
I decided to get into hair transplant surgery because it seemed like a natural way to restore the look that I had before. And I'm hoping to get a result of looking younger.
Men and women suffering from hair loss have a number of options, from pills to topical solutions, hair plugs to hair grafts. Dr. Ron Shapiro recommends a more natural approach, using the patient's own hair to fill in the gaps.
The whole principle of hair transplantation is you take hair from the back of the head and place it on the top of the head where people are losing it. So follicular unit transplantation accomplishes this because the follicular unit grafts are tiny, tiny 1, 2, and 3 hair grafts that take the hair the way it grows in nature. So you can replace it the way it grows in nature with 1 hair graft in the hairline and the 2 and 3 hair grafts further back to give density further back. So it totally imitates and recreates the natural hair patterns.
A hairline is the make or break of a hair transplant, and it's that level of randomness and naturalness that you need to have along that hairline to make it look natural. So it's not necessarily how many cases you've done or how many patients you've seen, it's just that artistic ability to be able to mimic a real natural hairline and create it for somebody. Dr. Shapiro has a perfectionist approach at every single patient. Everything he does is specifically meant to have the patient have a better result.
We all want to look our best. Thanks to the expertise of doctors like Ron Shapiro, hair loss, once an inevitable sign of the aging process, can look like a thing of the past.
I chose Shapiro Medical over other surgeons because I was most impressed with the staff here. And then after I did some research, I found that he was really world-renowned in his field, and so I decided I would come here.
Obviously, there's lots of clinics over the country and around the world that do hair restoration surgery, but I don't think you're going to find a single clinic that takes as much time with each patient and as much care, from the doctor to the patient. Dr. Shapiro, I've observed his surgeries many times over the years. We've done cases together, and he cares about every little part of the surgery. He's involved in every part of the surgery. He doesn't rush the surgery. He does 1 surgery a day. Everything he does is based upon the patient's results. And I just think that when you take that kind of care, that's the kind of results you get. And that's why the patients that come out of Shapiro Medical, they're very happy.
Hair transplants are very, very unusual in the field of cosmetic surgery in that it takes a year for one hair transplant to mature. So unlike other procedures where people can do 10 of them and learn over a couple months, it takes many years and many patients to finally get good and to be able to understand things. And we have done this for over 10, 15 years, so we've actually studied and written papers about natural patterns. So you have to have the technique and you have to have the experience.
I would absolutely recommend it to anybody that's looking at it. I referred my brother. I referred multiple friends to Dr. Shapiro, and they're all happy. I'm happy for them because their results came out excellent and very natural looking. No one can tell, nobody, unequivocally nobody can tell.
Even though I kept telling myself I wanted to be realistic, I was still surprised at how dramatic the results are. There's been differences in my business world, there's been differences in my relationships. I'm very happy with the results.
And the other thing we do is we contribute to the field. Actually, the field of hair transplant surgery has grown tremendously. In the past, there was probably 10 years ago, there was only like 30 doctors doing good hair transplants. But we've been involved in the development of the International Society of Hair Restoration Surgery. I'm on the board of governors. We've written textbooks. And because of this, there's over 100, probably 100, 200 surgeons in the country now that do this technique. There's a limitation to hair transplantation that there's only so much hair we have from the donor area. That may be overcome in the future with cell therapy. We may be able to take someone's hair, trim off some of the cells from the root, grow them in a test tube, and then inject them back. And this may stimulate a degree of hair growth. The combination of that hair growth plus Propecia, which is a medication that actually grows hair, plus the hair transplants, gives us many tools to really give people much more hair than they could in the past, and in a natural way.